Welcome to this week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you'd like to stop into the office, I'd love to meet you and give an opportunity to have a chance to answer any of your questions. You'll probably get a brief evaluation in the process, just because I'm always curious as to what's going on with people and validating the understandings that I have to help people understand how to restore their health. So that's always a good way, but since most people are a little reticent to meeting strangers in public nowadays because of COVID-19, that's why we moved our weekly healthcare class to a video format so that people wouldn't have to come to class. So that's why we're doing this class today. Another way to get a hold of me would be to call my cell phone directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I will usually be the one answering that phone. Please don't text that phone, as my phone does not receive texts, and I will not get back to you, and then that defeats your purpose for you trying to reach out to me. But you can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. And whether you stop in, whether you call me, or whether you email me, it's my pleasure to help you to better understanding what the current concerns you have regarding your health. This particular week's class is on the importance of your B vitamins. We did the A vitamins last month, and this is B vitamins, and understanding the importance of your B vitamins with regards to health. Now, B vitamins, with its 17 different fractions, is a water-soluble vitamin, which means that when you drink water in large amounts, you're going to lose your B vitamins, which is why you need to constantly be replenishing them. But the good news is that God created B vitamins in pretty much every food that we consume. So we shouldn't have deficiencies in B vitamins, and yet we do. And the question is well, why do we do? It should be impossible to become vitamin B deficient. So we need to appreciate, which we'll get into in a minute, but I want to give you what are the symptoms of B vitamin deficiency, so that you know whether this applies to you or not. And the symptoms are quite interesting. So any kind of numbness or tingling within your extremities or anywhere in your body, that's related to a B vitamin deficiency. Having any kind of heart irregularities, like a heart murmur, like irregular heartbeats, like mitral valve prolapse, those are related to B vitamins. The most common reason for why people go to the doctor, and that's fatigue. Just not having the energy that you think you should. That's usually associated with a B vitamin deficiency. Any kind of skin disorders related to inflammation, so your psoriasis and your eczemas, those are associated with B vitamin deficiencies. Loss of appetite, something that many people are experiencing as a result of the COVID situation, which is depression. The number of cases of depression has gone up exponentially as a result of not being able to conduct your life properly. It could be related to B vitamins, which we'll get into understanding why that would be in a minute. Headaches, inflammation anywhere in your body is related to B vitamin deficiencies. Elevated cholesterol. So people with elevated cholesterol, if your doctor's not talking to you about B vitamins and is just talking to you about statin medications, that you may want to get involved with some whole food B vitamins. High homocysteine levels, which is a marker that they use to talk about the amount of inflammation that ultimately leads to heart disease. Elevated blood platelets. We have hair loss, digestive symptoms of any sort, lack of energy, and last but not least would be diabetes. These are all conditions related to B vitamin deficiencies. And so why would we have a B vitamin deficiency with all of those symptoms affecting so many people in this country? It really shouldn't be that way, and yet we find that it is. It's related to antibiotic consumption, whether you take the antibiotics directly due to medical treatment, or whether you get the antibiotics secondarily due to the foods that you're eating that have also been treated by antibiotics. So what the antibiotics do is they disrupt your microbiome, they destroy the good bacteria, And so a solution to that would be to make sure that you're always taking a good quality probiotic on a regular basis, because you need probiotics to absorb your B vitamins, and you need your B vitamins to make your probiotics work. So there's a symbiotic codependent relationship there that's very, very important for your health. And if either one of those ingredients, the probiotics or the B vitamins, are lacking, then you're not going to get the required nutrients from your food, which ultimately is going to lead to problems specifically within the heart. What happens is when the heart doesn't have enough B vitamins, one of the things that it does is it twists on itself. So it torques in a way that doesn't allow the doors to close the way that they should, which could be leading to mitral valve prolapse. It also, the nervous system within the heart requires B vitamins in order to conduct the nerve impulses properly. And if you're not getting enough B vitamins, then the nerves won't fire regularly, and you may get irregular heartbeats. You may get skipped beats. You may get anything related to normal heart rhythm. And so we want to appreciate that when you take antibiotics, that the byproduct of that, if you don't take a probiotic and supplement whole food B vitamins, you could be setting yourself up for heart symptoms and ultimately heart disease. Now, what are good sources of B vitamins? Good sources of B vitamins are eggs. I have 2 eggs for breakfast every day. I'm not concerned about the cholesterol levels, because when your body consumes the cholesterol that's in eggs, ultimately gets broken down and absorbed into the bloodstream, and it's no longer in that format. It's what happens when that food then goes to the liver. If there's a lot of damage within the body due to eating crap food, the completely refined and processed food, then your body's going to need to repair those cells, and so it produces this white waxy substance, either good cholesterol or bad cholesterol, depending upon what's going on. Your bad cholesterol is more a sign of the amount of crap food that you're eating, and the consequence of that causes your bad cholesterol numbers to go up. So we'll probably cover that in a future class, but we got eggs, we got fish, we've got meat, chicken, bananas. I have a banana for breakfast every day. Avocados, dairy products, dried beans, green vegetables. Eat lots of green vegetables. You get your B vitamins. And whole grains. But based on the typical diet of most, it shouldn't be an issue to get plenty of B vitamins, and yet we have B vitamin deficiencies, and we have chronic heart disease in this country. And so why do people become deficient in a vitamin that's so readily available? It has to do with the antibiotics found in our foods and as medical treatments, which disrupt your microbiome and hinder your body's ability to absorb nutrients efficiently. It also has to do with the amount of white refined sugar that we consume. When we consume high amounts of white refined sugar, which, let's be honest, it's in everything, you're going to have difficulty maintaining a normal microbiome and absorbing your B vitamins. All white refined sugar has been stripped of their B vitamins. If you take sugar in its form made by nature in sugarcane is very, very high in B vitamins because it's a green plant. Lots of B vitamins involved in photosynthesis, etc. So if you were to eat raw sugarcane, you wouldn't deplete yourself of B vitamins. But if you eat the completely refined and processed, what I call the crap white sugar, then you're going to be depleted in B vitamins because there's no B vitamins in completely refined and processed white sugar. So when you consume the white refined sugar, with all the B vitamins having been refined out, it's going to create you're going to have to steal those B vitamins from wherever you can, whether it's from the cellular level, whether it's from the tissue level, or whether it's from the organ level. And if that organ level happens to be your heart, then you're going to have heart disease and heart irregularities that will eventually lead to heart disease. And we don't want that. In your heart, B vitamins are required to make the nerves function that causes normal heart rhythm. So when you're lacking those B vitamins that feed the nerves that promote normal heart rhythm, you're going to have misfirings in your heart. You're going to get skipped beats. You're going to get irregular beats. You're going to get potentially tachycardia, moments of tachycardia, in an effort to try to make up for the skipped beets, etc. And so you'll notice a lot of different heart symptoms going on, and this is typically due to B vitamins and probiotic deficiencies. This is ideally the foundational reasons for why we get heart disease and why we have so many heart-related issues in this country. And so it doesn't have to be that way. So you're going to know that you need to take probiotics and a good whole food B vitamin. The B vitamins that we use in our office are made by standard process. The supplement is called Cataplex B. You can get Cataplex B in a gluten-free form for those of you who are gluten sensitive. But you also need to make sure that you're taking a probiotic, because without these, you're going to develop a B vitamin deficiency, and you're going to lead to all sorts of heart-related symptoms, fatigue, inflammation. Inflammation is a byproduct of lacking the proper ingredients that the body needs to function. So if you have inflammation in your heart, it's because your heart isn't getting the necessary ingredients. And ultimately, that's what leads to heart disease. So I hope you can appreciate the importance of your B vitamins. I truly appreciate you tuning in this week. Please feel free to call me at 845-561-2225. If you have a question, you can email me directly at docrick@spineboy.com. That's my email. You can stop into the office at 138 Canal Street in Pooler Park, Suite 404 of Building 400. So whether you call me, email me, or stop into the office, either way I want to answer your questions. Please feel free to give me feedback on this video if you felt it was helpful. That's it for this week's class. I would look forward to speaking to you again next week when your health matters. Thanks again.